The combined use of Chinese and Western medicine is described by a popular saying, 两条腿走路. China walks on two legs, one traditional and one new. The curriculum for all medical students now includes courses taught by Chinese pharmacologists who once considered medicinal recipes to be highly prized secrets. Learning to identify all the ingredients can be a difficult task. 10% of the students at the Liaoning School of Chinese Medicine are People's Liberation Army soldiers. Nearly half of the other students were barefoot doctors before entering medical school. In 4 years, they will become physicians with a specialty in Chinese medicine and will help train barefoot doctors in the use of herbs and other medical techniques. One reason traditional medicine is supported by the government is because it makes good use of available materials and natural resources. Wild herbs are preferred because they are considered to be more potent. This class of medical students in Shenyang, north of the Great Wall, is collecting herbs in the wheat field surrounding Beiling, the tomb of the father of the first Manchu emperor. Seeing these young students at the ancient tomb reminds us that China's medicine does indeed walk on two legs. The Chinese say that by combining traditional and modern medicine, the old can help the new, and the past can serve the present. The Liaoning School of Chinese Medicine is one of several medical colleges which specialize in developing new techniques from traditional ones. It operates a small factory where medicines are made by simple and inexpensive methods which can be used by barefoot doctors with limited equipment and training. Ingredients are chopped, dried, and shredded, then ground in large stone mills. Some mills are patterned after designs several thousand years old, with electricity replacing the traditional power source. Some of the medicines are made according to age-old prescriptions. Others are new formulas developed by the school's pharmacologists. Small quantities are ground in a foot mill. Others are blended and granulated in an air-blown tumbler, or finely powdered and made into tablets. The machines, like the medicines themselves, are made from available materials. The college also supplies herbal medicines to 4 rural hospitals and an outpatient clinic. Individual prescriptions are dispensed at herb pharmacies at the school. The price of medicines has decreased by 80% since 1952. As a result, Increased demand has generated a scarcity of wild herbs. Posters illustrating substances with medicinal value are distributed among the peasants, who can help barefoot doctors gather more herbs. Prescriptions are double-checked by one of the pharmacists, then bagged and labeled and sent to the pharmacy kitchen. The cost of prescriptions, along with the doctor's bill and other hospital fees, is usually covered by insurance. In the pharmacy kitchen, prescriptions are placed in individual cooking pots and brewed into medicinal teas or syrups. The Chinese phrase for taking medicine is 吃药, to eat medicine, as one would 吃饭 or eat food. In some ways, the modern-day usage of herbal medicines can be considered an extension of Chinese nutritional therapy, a means of preventing and curing illnesses with food, which was popular long before the arrival of Western medicine. Some herbal medicines are new combinations of traditional ingredients, such as this thick medicinal syrup, which will be made into Chinese-style medicine balls. The formula for this type of medicine, which is somewhat like an aspirin, was developed by herbalists at the school, who are very proud of its therapeutic properties. According to directions on the back of the package, small bits taken with water should help to cure headaches and colds. In the school's outpatient clinic, other traditional remedies are tested, then taught to barefoot doctors. One is called Zhuguan, a counter-irritation treatment for rheumatism, in which heated bamboo sections are applied to the skin. Another is Jufa, or moxibustion. Balls of herbs are placed on the skin and lit, causing small blisters to form. A Zhuguan patient must return several times for the treatment to be effective. A stimulating suction is created when heated air in the bamboo forms a partial vacuum as it cools. Like many other traditional remedies, Zhuguan treatments are simple to perform and do not require expensive medical equipment. Acupuncture has become well known as an anesthetic, but in addition to its ability to mask pain, it can also stimulate areas which have lost sensitivity. Needles of varying lengths are inserted at different points depending on the nature of the ailment. Occasionally, acupuncture is used in conjunction with another treatment called Baguan. It is similar in principle to Zhuguan, but creates a more powerful suction. Baguan is not uniquely Chinese. It is also practiced throughout the rest of Asia and in the West, where it is known as cupping. A traditional method of removing tonsils by cauterization is also performed in the clinic. Small irons are heated over a flame and dipped in an herbal solution before being placed on the tonsil. This is a simple but time-consuming process because only small areas are removed at a time. As many as 10 visits may be necessary to remove both tonsils. The doctors say that this method would be more practical if only 3 visits were required. Although most barefoot doctors do not perform dental work, they are occasionally required to extract teeth. For this, they rely on a relatively painless method called acupressure. The purpose of this simple technique is to eliminate the need for expensive dental equipment, such as hypodermic needles and Novocaine. The doctor places his hands on the patient's face and exerts pressure on the upper maxillary nerves. This creates a temporary numbness, similar to what happens when one's foot goes to sleep. After a few minutes, additional pressure is exerted on the patient's tooth. This tooth is being removed for cosmetic reasons. After the extraction, an herbal solution is applied to stop the bleeding. This simple acupressure technique is now being used by many barefoot doctors. While improved health in the countryside can be attributed to better medical care, it is also a result of better nutrition. Much effort is devoted to increasing the supply of animal protein. Dairy products are being introduced. Animals are raised both communally and privately. Whatever a family does not use for its own consumption can be sold at the local market or to the state. No farm would be complete without its backyard animals. Pigs are bred not only for their meat, but also for their manure, which is the main source of fertilizer. There is currently a campaign to increase the number of pigs, which the Chinese call mobile fertilizer factories. A barefoot doctor specializing in the care of animals occasionally visits peasant breeders. They call him a barefoot veterinarian. Medical attention for sick or injured animals has always been important to the Chinese peasant, whose livelihood once depended on the well-being of his beasts of burden. Cases which cannot be dealt with effectively by the barefoot veterinarian are referred to animal clinics on the commune. At the animal clinic, veterinarians administer both Western and Chinese medical treatments. At the August 1 commune, one of these techniques is demonstrated on a horse with a hoof injury. A popular remedy for many human ailments, acupuncture is also used to treat sick animals. Insertion points are charted and labeled like those for human beings. Horses with colds, vertigo, inflammations, or hemorrhages are treated with acupuncture. Acupuncture is also performed on other valuable animals, such as cows and bulls, as well as seed hogs and sows. A barefoot doctor specializing in midwifery assists in childbirth as well as prenatal and perinatal care. This midwife is visiting a young peasant mother a week after the birth of her first child. A tremendous baby boom has resulted from the relative prosperity of the last quarter century, during which China's population increased by 60%. China is now conducting an intensive family planning campaign. The government encourages late marriages and small families. Ideally, women should be 25 and men 28 years old before marrying. Although the average birth rate is less than 2%, it is somewhat higher in the rural areas. Peasants still tend to marry younger and have larger families than urban dwellers. This mother is only 21. Before 1949, China's infant mortality rate was extremely high. With better living conditions and trained healthcare personnel in the rural areas, infant mortality has been drastically reduced. This 7-day-old baby boy, wrapped in red in the traditional Chinese fashion, can look forward to a long and healthy life. At the August 1 commune, a doctor and a midwife discuss birth control methods available on the commune. All contraceptives are provided free of charge, with the exception of the condom, which costs a half cent apiece. Although they are sold in stores, condoms, like other contraceptives, are available to married couples only. Birth control pills and intrauterine devices are more popular. Chinese factories in Shanghai produce more birth control pills than any other country in the world. Other contraceptives, such as the paper pill, are being developed at government research institutes in Peking and Shanghai. This midwife keeps records for every family in the brigade, indicating which method of contraception is being used. Here, she explains a record book for IUD insertions. Vasectomies and tubal ligations are encouraged for parents who have completed their families. Patients receive time off with pay during the operation and recuperation period. Abortions may be performed in the event of contraceptive failure. The permission of both parents is necessary, and occasionally that of grandparents as well. Specific birth control information is not available to unmarried people, but the pros and cons of various methods are discussed in a small family planning booklet that newlywed couples receive as a gift from the state.
计划生育有哪些意义？伟大领袖毛主席教导我们。
In China, family planning is not only a personal matter, but a national concern. Messages are broadcast over radio and the ever-present loudspeaker. The advantage of having small families and limiting population growth are explained in terms of promoting better health and improving living standards for all. Parents should have only 2 children, with a recommended spacing of 4 years. Propaganda work is necessary to counteract the pressures from grandparents to have more children, male babies in particular.
你这孩子多大了？
这孩子4个月。
啊，这孩子以下你就带的怀。
啊。
来过月经吗？
没有。
这孩子还挺胖的，体格挺好。
Midwives and barefoot doctors also deliver birth control pills to married women on the commune. Barefoot Dr. Xiao Shu delivers a once-a-month birth control pill that is being tested on her commune near Shanghai.